Greetings. Let us learn about the anatomy of small intestine that is relevant to endoscopists and also endoscopy technicians and nurses. And these are our learning objectives. And as you can see here, the small intestine starts here, and the stomach actually enters the small intestine, and the opening is the pylorus, and the small intestine starts here and goes a long way, and then it enters the right colon. So there are lots of different sections to the small intestine. The first section after the stomach is called the duodenum, and this is about 20 to 30 centimeters in length, and a lot of digestion starts in the duodenum. The pancreatic juice and the bile enter the duodenum and start the digestion process, and also some of the absorption happens in the duodenum, especially iron, calcium, and some of the fat-soluble vitamins. The next section after the duodenum is the jejunum. It is 2 meters in length, and in the jejunum the digestion continues and absorption continues. And the next section is called the ileum, and this is 3 meters in length. In total, small intestine is about 5 to 6 meters in length. Most of the absorption is completed before the contents exit from the ileum into the colon. This is the section that also helps in the absorption of vitamin B12 as well as bile acids. There is a valve, the ileocecal valve, that puts a brake on exit of contents from the small intestine into the colon. And this is the valve that we look at when we do the colonoscopy. So let us learn a little more about the duodenum. So there are different sections to the duodenum. The first section is known as duodenal bulb, otherwise known as D1. The second section, that is the descending duodenum, is otherwise known as D2. And the third section that goes across transversely is known as transverse duodenum, or D3. And then it goes up, that is the ascending duodenum, or D4. And then the duodenum enters into the jejunum at the duodenojejunal flexure. So that's the bend. This C loop is intimately related to a lot of important structures, and let us figure out what are the structures in relation to D1, D2, D3, and D4. So here is a much more detailed diagram. We have removed the D1 portion of the duodenum so that you could look at what is behind the D1 portion of the duodenum. As you can see, the bile duct, a little bit of the cystic duct, and maybe sometimes the gallbladder, they're all behind the in close relation to the D1. That is the duodenal bulb, the first portion of the duodenum. The portal vein and the confluence could also be seen when you do an ultrasound, because it's closely related to the D1. The pancreas is also related to D1. When you look at the D2, there are a couple of important structures. On the medial side, the pancreas is closely related to the D2. The bile duct and the pancreatic duct join and open into the D2. This is the major ampulla. A small duct of the pancreas opens through a smaller opening called minor ampullary opening or minor duct opening. In this side, this duodenum is in close relation to the kidney and the adrenal gland. Next, when you look at D3, as you can see, the pancreas is closely related to the D3 and the uncinate process. And there are two big vessels. One is the superior mesenteric vein, and the other one is superior mesenteric artery. They go in front of the D3. And the next is the ascending portion of the duodenum, or D4. So as you can see here, a lot of structures are in close relation to the duodenum. So now let us look at the blood supply of the small intestine. The major blood supply, almost the entire small intestine, is supplied by the superior mesenteric artery, which gives branches to the jejunum, and those are called jejunal branches, and to the ileum, the ileal branches. And the blood from the small intestine is drained back to the liver via the superior mesenteric vein, and then it joins the splenic vein to become the portal vein, and the portal vein empties its blood into the liver. A portion of the duodenum is supplied by the branches from the celiac trunk as well. So here we have learned about the different sections of the duodenum, the special relationship of the pancreas to the first, second, third, and fourth portions of the duodenum. We have also learned about the vascular supply as well as drainage of the small intestine. Thank you.